Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about Medicare enrollment for providers using the PECOS or PECOS, however you want to pronounce it, system. To start off, I want to explain what PECOS, which is an acronym, stands for. It stands for Provider Enrollment Chain and Ownership System. The PECOS website is used for enrollment for groups and for providers. It is the same login credentials that you would use for the NPES system, which is where you would apply and manage your MPI numbers for both provider and groups, as well as the identity and access management system, which is the actual portal where you would be provided the login credentials for all three. You do have to log in separately for all three of these, but you use the same login credentials that you obtain from the identity and access management system. I have some other videos screen sharing on how to enroll a group through the identity and access management system in order for it to be recognizable in NPES and PECOS. So if you haven't done that yet and you're needing to enroll a group and or a provider in Medicare that's associated with the group, you need to go watch that video. PECOS, how I pronounce it, some people say PECOS, has a lot of YouTube videos, tutorials walking you through how to do certain things. And I get some questions sometimes because it can be a little confusing about if I'm a new provider in a new state for Medicare, but I'm already in Medicare in other states, how does that work? Well, that's a good question. So there's some different ways that a provider would be enrolled or needing to be enrolled in PECOS. If the provider has never participated with Medicare in a specific state, now remember, even though Medicare is a federal kind of process, plan, whatever you want to call it, system, it is managed state by state. So providers have to be enrolled in each state in which they will bill Medicare. So if New Jersey is separate than New York, which is separate than Florida and California. It all can be done through the PECOS website. However, you kind of have to figure out what is going to be the situation. So if the provider is going to be a sole proprietor and they are just themselves going to be billing for services and nothing more, not going to be associated to a group or organization, then that is an option when you're doing provider enrollment. If it's a new state, then it's a clean slate. It's a new provider enrollment for sole proprietorship, and it walks you through how to do everything. If the provider is going to be working with a group or organization, then it will give you some options saying, like, one, is it going to be some group or organization in which they own, like solely own, but it's a separate entity between them and their personal finances, like they're recognized as two separate, then that's an option. If the provider is just going to be an employee of a group or organization, there's no ownership or anything, then that would be the option you would select. And then there's an option where they might be like self-employed and working for a group. So maybe they're thinking about starting their own practice, or they are going to start their own practice, but in the meantime, they need to work and be an employee at another practice because they need to have some regular income coming in to be able to feed this new practice, then that's an option. So you got to make sure that when you initiate this enrollment, one, that the provider is new to that state, right? And two, you need to pick the best option for that provider enrollment. So whether it's a sole proprietorship, they're an owner of a group or organization that also needs to be enrolled, they are just going to be an employee of an existing group or organization that's already created in Medicare, you would choose that. Or if they're kind of be a hybrid approach where they're going to be a little bit of self-employed and own some kind of health organization to bill out of, and they're going to be an employee at an organization that already exists. So you have to kind of pick your best option. If you're not sure, look at the resources online at your Medicare contractor website, or call your Medicare contractor, explain to them the situation, and they should be able to help you. You do need to have an MPI number when you're calling the MAC or the Medicare contractor. So make sure that if you do have questions that you have an MPI available to be able to enter in the system to be able to speak with someone. Now, if the provider has already worked in that state and they're working either under their own practice or organization and they need to join another organization or group, they can be reassigned. If they're already an employee at one group or organization, they will need to be reassigned to a new group. Okay, so if they're brand new, it's new enrollment. If they're existing in the state and they're working for other groups or something like that, then they need to be reassigned to a new group. A lot of people ask me, does this affect their existing assignment with their existing employer or existing entity? And the easy answer is no. They will be assigned a PTAN specifically to be used, or Medicare identification number, at that entity. And then once the new entity reassignment is completed, they'll be given a PTAN or Medicare identification number specific to that entity. And that's how Medicare will keep it apart, because a lot of providers could work for multiple different entities if they're part-time somewhere, or they own part of their own practice and they work, like I said, for someone else until their business gets up and off the ground. There's many situations, so it doesn't affect it. You actually have to go into PECOS and unassign a provider from an entity if you want it to change. So it doesn't automatically, when you apply for reassignment to a new group, take them away from their existing group. It doesn't work that way. They actually have to go in there and you have to change the enrollment and unassign them to that group. So that's really nice. Some people, and actually a lot of people, forget to do that part. So you might log in as a surrogate and working on behalf of other providers, and you'll see that they have all these assignments under it. And you're like, that's really weird. They haven't worked for them for 5 years, 10 years. It's because nobody has gone in there and unassigned them from that group. And so if you see it, I recommend doing it, getting it taken care of. Of course, confirm with the provider first, but that helps keep it clean. So again, Medicare enrollment, it's also kind of how they credential and contract. They just call it enrollment. Medicare always has to be different. It's the government, right? So Medicare enrollment, synonymous with credentialing and contracting for providers. There's either new enrollment, if it's a new state participation, and then deciding how they're going to be working in that state as a Medicare provider. And then reassignment if they're already working and participating and servicing Medicare patients, you would need to reassign them accordingly. If you have any questions or comments about that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues. I appreciate the support. We'll see you next time. Bye-bye.